right, I think we're going to start our Q&A session a little early. I'm Dr. Katherine Harris. I did one of the talks earlier. It looks like I don't see anything in the chat. Johnson, are there any questions in the chat?
We got one. Should bone density test be a routine exam?
In my opinion, yes. The debate comes more into the timing of it and the frequency that you do it, and that's kind of where the data is. We still need more data to determine those things. There are particular seizure medications that we know, and mostly they're older ones, things like valproic acid, phenytoin, that are known, carbamazepine, that are known to have higher risk of osteoporosis, brittle bones over time. And so particularly for those medications, I think it's much more important. But even some of the newer ones like oxcarbazepine, for example, it's something that should be considered. It's definitely not something you need to do every single time you see your doctor, but it's something to bring up and to ask about if that's something that should be monitored. And then the discussion is more of the time of like when you should do it and how often. All right. I don't see a lot else in the chat. I think, Morgan, you were sending me another message, but I don't know if it was a question for this or what it was.
I think this is the last panel and we don't have any more questions. Morgan suggested if we should just briefly mention why Epilepsy Center. Oh, actually, hold on. Let's see. One more question. Why high incidence of miscarriage of male fetuses?
I'm not sure if that question is referring specifically to something that was in someone's talk. There are some causes of epilepsy with genetic reasons where, and this is, okay, so PVNH. Okay, so this is probably from Dr. Tandon's talk. So not every single person with PVNH has this as the cause, but there are some genetic causes of PVNH that are X-linked. And so that's one of the chromosomes that is passed from females. So if you're a female, you have two X chromosomes. So presumably you would get one from each parent if you're a female. So if you have one that's a problem, the other one a lot of times can help balance that out. Versus if you're a male, you get one X and one Y. And so if the problem one is the X one and you get that one, and then you get the Y from the other side, it doesn't really balance out. And so so for male fetuses that are an XY combination, when that genetic abnormality is in the X, that's why there's a higher chance of miscarriages in the males than in the females, because they don't have an extra X chromosome to sort of help balance things.
We got one more. Do we know if there is an increased risk of mood disorders in child of women on carbamazepine?
Carbamazepine, yeah.
Sorry.
I don't know any data off the top of my head that would suggest that with enough strength that it would cause me to not use it. Yeah, no, the ones that I tend to avoid a lot more in women of childbearing age, definitely valproic acid is one of them. That's one that has fairly strongly been shown to cause problems beyond just development in utero. So even babies born to mothers on valproic acid have been followed for a few years after that, and they have been shown to have slightly lower IQs as well as a higher risk of autism. So that would be one in particular. I am not aware of strong data for carbamazepine use causing higher incidence of mood disorder in children, though. But all these things, though, are areas that we continue to research. So if you or anyone you know is a woman who's pregnant, definitely register for the North American Registry for Epilepsy so that we can continue to collect data for all of these things. All right, I don't see any other chat questions. If you have any other questions, feel free to type some more in. But otherwise, thank you to everybody for listening to all the talks. This is the first time for our particular epilepsy center at UTHealth McGovern in Houston to do this. So it's been great putting it all together. So just, I think one of the things to remember is like, what can an epilepsy center offer you that might be different from just a general neurologist? And I think we've had several talks that have talked about some of the specialized testing that can be done to see if, if you've not responded to seizure medications, if there might be other possible treatments for your epilepsy, different kinds of surgery or different kinds of neuromodulatory devices. If you wanted to talk more about CBD as a treatment, those types of things are things that an epilepsy center would be able to offer you that most general neurologists wouldn't. So it's our goal for all of you guys is to live the lives that you want to live, decrease the side effects that you have on your medicines as much as we can, so that your seizures are controlled as best they can be, ideally seizure free, but if not, at least decrease them, so that you can do the things you want to do in life. Let's see, I see another question. Are you adult only? Yes, I am an adult epileptologist. We do have, though, 4 pediatric epileptologists in our group. So they gave some of the other talks. So Dr. Von Allman is the lead of their division. And then there's Dr. Lankford and Dr. Watkins are 2 of the others. And Dr. Kamaru is the 4th one. So if we definitely have folks in our group that do pediatric epileptology as well. Any other questions? All right, well, thank everybody for contributing to the talks if you're one of ours listening. And then if you are a patient with epilepsy or a family member of a patient with epilepsy, thank you so much for tuning in. And we really appreciate your time. And if you want to come to Houston and meet some of us, I think Morgan has put a lot of our center's contact info in some of the slides, so feel free to reach out.